I invite now Chairman of the Board of Directors of the Tobago Regional Health Authority, Mr. Keith Charles, to address you.
The Honorable Orville London, Chief Secretary, Mr. K.C. Roberts. K.C. sounds familiar. Keith Charles, got it. Representing the Honorable Vanilla Allen Toppin, Secretaries of the Tobago House of Assembly, Honorable Councillor Mr. Huey Cadet, Assistant Secretary in the Division of Health and Social Services, other members of the Tobago House of Assembly, Ms. Heather Caruth, Administrator, Division of Health and Social Services, other administrators, fellow members of the Board of Directors of the Tobago Regional Health Authority. I've recognized Director Cecile Beckles and Director Karen Trim so far. Director Larry Paul, etc. Mr. George Bell, Chief Executive Officer of the Tobago Regional Health Authority. Dr. Radix, the CMOH. Marissa Wharton Hector, the media, ladies and gentlemen. Good morning. Last week, Mr. Chairman, you gave me about 10 minutes, but I used 4 of those minutes. The communications expert at the TRHA has prepared my talk for this morning. And after seeing the seminal work that she has prepared for me, Mr. Chairman, I have to take back 6 of those minutes. Added to what you gave me today, please bear with me a little bit. Let me then begin by thanking the Chief Secretary, Mr. Orville London, and other members of the Executive Council of the Tobago House of Assembly, Mr. Albert Pilgrim, Secretary of Health and Social Services, and Assistant Secretary of Health, Mr. Huey Cadet, in particular, as Chairman of the Steering Committee for the Commissioning of the Health Center, for leading us this morning as we mark the official opening of the Scarborough Health Center. And I welcome them here along with our distinguished guests, and most importantly, along the men and women who comprise the staff of the Scarborough Health Center. It's been said that the best reward in life is the chance to work hard at something that is worthy of doing. Now, as chairman of the outgoing board of directors of the Tobago Regional Health Authority, and speaking on behalf of the other directors of the board, we are truly honored. We are truly honored to be here to mark another milestone in the pursuit of strengthening healthcare services in Tobago as we expand on the health platform in the island. The new Scarborough Health Center is indeed a far cry from the cramped facilities at Robinson Street, and it is the flagship amongst our 19 community health facilities. Now, this health center most notably embraces our concerted and united efforts to move our primary care health services to perform true to their core functions of prevention, wellness, and education. And when we tour a little later, and I understand to be guided by Marissa, you will see what I mean. We expect by doing so to create a positive shift in the public's opinion of self-health management and prevention of chronic diseases. Now, this outcome is essential in the long term to decrease the level of lifestyle diseases that, if permitted to grow, will negatively impact on the resources, both financial and human, at the secondary care level. As I expect most are aware, this celebration is for the Board of Directors a bittersweet one. While this morning is an opportunity to celebrate the accomplishments of the many numbers of individuals who are responsible for this present facility and its services, it is also a chance for me, on behalf of the Board of Directors, to convey our gratitude and farewell during our 2-year tenure. The board demits office in 2 days' time. Now, early in the life of the board, we engaged, a little history I'm giving you here, all our stakeholders, the THA, the clinical and non-clinical staff, the patients, the business sector in Tobago. We researched the national health-related policies. We looked at health trends in the international community. We reviewed past board perspectives on health in Tobago. We, in other words, examine ways in which we can improve healthcare delivery in a sustainable way and made a decision to implement our initiatives aggressively but incrementally. And I recall having a discussion with the very same Marissa again. She's multi-talented. And we spent some time talking about these initiatives. And she went home with the information, and within a couple of days she came back. And she says to me, you know, I gave her all kind of fancy names, you know, 4-quadrant this and so forth. But she came back to me and she said, you know, let's call it the 4-point plan. We developed a 4-point strategic plan which address some of the main issues and deficiencies which have plagued the healthcare system in Tobago for many years. A list of 43 pressing deliverables were identified. Ladies and gentlemen, I am pleased to inform you that this present board was successful in completing 22 of the 43 deliverables. Essentially, thank you. Essentially putting in place the necessary measures for the operations of a strengthened healthcare delivery system. We have also initiated and activated work towards the remaining 21 deliverables so that the new board will have a foundation on which to build. Strengthening primary care, the emergency medical services, and hospital service delivery systems were the top priorities of the Board of Directors as the backbone for ensuring an improved healthcare system in the island. Now look, in 2009, there were 66,914 visits to the combined services of outpatient, inpatient, and accident and emergency at the Scarborough Regional Hospital, and 106,000 visits in the primary care services. The impact of public healthcare services arguably touches most households in Tobago. Last 2 weeks at the Joint Select Committee, the CEO regurgitated some figures. He speaks about instances or situations where we have to rush our patients to Trinidad. It's a high-cost exercise. He talks about one bill exceeding $700,000. It is normal for a bill to be 40 and 50 and 80 thousands of dollars and so forth. So that when our patients have to spend an average of 3 days at the hospital and be seen by some of the best specialists in the country, be attended by and be facilitated by a series of tests and so forth, it's a tremendous cost incurred in providing that service.